Hello out there and welcome to Public Conscience. This is the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society group with a mandate to promote good governance, participation and accountability in Nigeria. I am Adaobi Obiabumo with Chidozie Obunnaya.
Welcome to the program.
On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing government and citizens' attention for democratic actions against it. This program is supported by the MacArthur Foundation. And on today's program, we will turn the spotlight on how some Nigerian doctors, hospitals, diagnostic centers are defrauding patients through coordinated kickbacks for referral. We anchor today's focus on the extensive investigation by Premium Times cutting across health institutions where patients bear the brunt of high medical bills due to kickbacks from referral.
Over the years, the Nigerian healthcare system has been characterized as poorly developed.
The National Health Insurance Scheme, NHIS, which should have helped in cushioning health expenses of citizens, has only covered 5% of the Nigerian population, most of whom are in the formal sector, leaving the informal sector and the most vulnerable populations at the mercy of healthcare services that are not affordable since its launch in 2005.
Today, nearly 72% of Nigerians' total health expenditures are reportedly paid out of pocket, which fast-tracks the poverty of the citizenry.
Unfortunately, the situation became more worrisome as a 20-month investigation by Premium Times posed how some doctors, hospitals and medical laboratory service providers connive to defraud patients of billions of naira annually through a referral kickback scam.
In 2018, it was estimated that Nigerians pay at least 4.8 billion naira for medical bills as a result of kickbacks. Regrettably, the situation has encouraged some doctors in deceiving their patients with the aim of extorting them against Section 33 of the Code of Medical Ethics of Nigeria.
And to help us better understand these challenges in the Nigerian health sector, we have in the studio Lemi Uwegwe, Communications and Advocacy Director, Make a Difference Initiative. Thank you so much for joining us.
It's my pleasure.
We will also speak with Nicholas Ibekwe of Premium Times, who wrote this report. He will join us via phone from Lagos. Hello, Nicholas.
Hi, hello.
Okay, thank you so much for the extensive report on the referrals and kickbacks done in the medical institutions. Could you please give us an overview of your report? How long was this investigation and how extensive was it?
The report took 20 months. We had known that this practice is something that happens in the country, but nobody has reported it before, or nobody has come out to actually go inside the industry to understand how endemic it was. So we set out to try to because it's a closed industry. You have to, and it also requires some expertise for you to be able to even get into it. I mean, I am not a doctor, I'm a journalist, and I don't understand many medical terms and all of that. So it took a while before we broke that barrier. We had to get somebody from the inside who was able to put us through what is done and how it is done. So we started our investigation. We started by applying, sending people for referrals, and we started by we first of all set up a fictitious hospital, somewhere in Mowe, Ogun State. We deliberately picked an out-of-town hospital because
nobody saw your ID card and nobody went to the hospital.
Nobody asked for it. Not even. Oh, I asked and I said, oh, I'm not with it here. I'll get it for you later. They didn't even ask to see the hospital. It is that bad. Nobody even. So what it means is that any quack out there can go out and refer people for tests, and nobody would doctors are registered and all kinds of shenanigans, like you can see in my story, are done through that app. So that was first difficult for us to get in because we had to get in the app. They were not going to make referrals from the public. You have to be registered in the app, and before you register, you also they demand that you have to submit your medical certificate. You know, your medical certificate, which we find a way around. We got a graphic designer to design something for us, which luckily they did not detect it. That it was photoshopped.
So they didn't do an extensive work before registering you.
Yeah. So and then in fact it was even run from India because it was an Indian-owned company. So you have to send the referral to somebody in India who your certificate, somebody in India who will look at it and all of that. Then they will not send you a link and a code for you to be able to use the app. The app is called Hello Doc app. It's on Apple Store, it's on Google Play Store. But if you download the app, you cannot use it. You cannot get into the app except somebody up there approves you and allow you to be able to get into the app. So after we sent the report and all of that, they basically allowed us to use the app. So that was when I got into the app and I saw the whole shenanigans. They were giving whole house loan for referral. They were giving car loan for referral. You could get your money to buy a recharge card. You could go to a spa. They were giving for the number of referrals you do. They were giving you. They had a loyalty token system which they call healthies. And each healthy, one healthy is worth £1.
Nicholas,
so,
these medical laboratories, are some of them owned by Nigerians?
Yeah. In fact, most of the ones we looked at, some of them were owned by Egyptians, Indians. But a handful of them was only, Union Dad is not taking, it's a fully Nigerian-owned medical laboratory. In fact, it was actually quoted in the stock exchange. In the Nigerian Stock Exchange. So it's a public quoted company and in the Nigerian Stock Exchange. So it's not just an ordinary company. It sells shares. Shares are marketed on the stock exchange and all of that. So yeah.
Let's get back to how some of these doctors in cahoots with the laboratories defraud Nigerians. What did you find? How do they do this?
It's very simple, When you go to a lab, you tell them, I'm a doctor, I want to be sending you referral. They register you, they get your phone numbers, register your name, they collect your account number. So you have to send them, at the point you'll be required to send, hello?
We can hear you, go ahead.
Okay, stop, okay. So at the point you'll be required to, so when you make referrals, there's a place where you have to write your name, you have your doctor, so and so making the referrals. So you make referrals, and the patient innocently does not know that this is what is happening. So you go to a doctor, you go to a hospital and say, you have to go and do so and so test, you have to do so and so test before I can treat. So you take it and they give you, and they say, what they actually do? One is that first, initially, once the process was that they say, take this and go to this particular hospital. But now they don't find a way around it. The hospitals, not the hospitals, the laboratories, now give them their own referral booklet that has the laboratory name, laboratory letterhead. You can see from my picture, they have their own laboratory booklet. So you have no choice. When you go to the doctor, he writes the name of that lab on using the laboratory referral booklet for you, or the laboratory slip with the referral name and everything. So you just put his name there and you go. You don't know. You go there for a test and you're asked to pay 50,000, 100,000 for it. Depending on the test you want to do, or 5,000 or something. But once you go, you get your test and you leave. But at the end of the month, if the doctor has done a cumulative of a test worth in that month, let's say for instance October, the doctor has sent you several tests and the cumulative amount of the test is done is say perhaps 200,000, So what they do is they pay you the 20% of the 200,000.
Let's get it clear now. Let's say it costs 30,000 for tests for a walk-in patient into the lab. and I am referred to a particular lab by a medical doctor, instead of paying 30,000, which is the normal price, I will pay higher because there's a particular percentage from the amount I paid.
No, that's how it works. You don't know if it's higher. The hospital, they have a rate. You know, they have a rate. For instance, they know that the rate of the test, say for example, malaria test is 5,000 naira. They have a rate. But you won't know that in that rate, in that cost that they put for the fee of the rate for the test, they have factored in already. They have factored in the 20% already. So if ideally they could have done a test for you and still make profit for 4,000 naira, they would originally bump the test up to 5,000 naira because they want to incorporate the 1,000. Let's assume that 1,000 naira is the 20% of the test or for the doctors. So you don't know.
So this referral, the kickbacks, is not at the interest of the patients.
Right. No, that is several reasons why it's not at the interest of the patient. One, it makes medical bill very expensive because there's no ailment ideally you can go for without doing a referral, without coming from a referral from a doctor and say what's the ailment. Some tests go for as much as 500,000 naira. You know, just one test. I mean, you know, so this is how it's not so. It makes it immediately expensive. I mean, consultation is not even that very expensive when you comparatively as expensive as diagnostics. You know, I mean, consultation fee is not that as comparatively when you compare both together. It's not that expensive. So you go for this diagnostic. It makes it funny. Again, what it also does is that it creates an incentive for doctors to send you for frivolous tests. When people have gone for all kinds of tests, doctor will come in and your symptoms suggest that you have malaria. But doctor, knowing that you are a layman, you don't understand this thing. And how many people don't understand this? You're already sick. You at that point you just wanted to get well. You know, you're not even at the right frame of mind to challenge the doctor, except you're a doctor yourself. You understand? Or you have some kind of medical training. You know, and even if you're meeting an expert, and whatever he says, you want to do it.
All right, Nicholas.
Yeah.
Upon these findings, who do you speak? Because I from your report we read that you mentioned even the names of some. You just said MacArthur and other diagnostic centers. Did you get their take on this scam that is going on?
Yeah, we try to reach all of them. I mean, it's only one of them that got back to us with a response. You know, we try to reach all of them. All of them. We wouldn't have done a story that is not balanced, or we have heard from them. All of them we sent email. All of them we made phone calls back to have after we completed our investigation to have them respond to that. And they basically ignored us. The only one who responded denied that they were not doing it, but we had our evidence that their marketer was doing that. The other company also said, they were not doing it. Similar was one of the one that said they were not doing it. Yes, they don't do it, you know. But the funny thing about Similar is that their rep actually told us that we don't do it, but you know, there's a way around this thing. If you want to make extra ones, you can basically we'll give you our slip to make referral. So we don't share the cost with the patient, but you already know. So if the cost slip that we're giving you so that the test is 20,000 naira, as a doctor, you are free to make it 50,000 naira or something like that. She told us that.
Okay, let me take you back to what you said earlier. That some of these doctors ask patients to go for tests that are not needed. In your report, you mentioned that an 8-month pregnant woman was asked to go for a CT scan that she didn't need. Could you please tell us more about that?
Yeah, there's one report like that. I mean, that was after that when I was getting views. I mean, a CT scan. I mean, that husband had gone to the hospital. She was almost due, you know, and the man said, the baby was not well positioned and all of that. And I said, go for the CT scan. Luckily for them, because you know when you expose that young fetus to radiation, CT scan involves radiation for an adult. I mean, some of these tests are not the tests that they are tests that you do at the last resort because of radiation involved. You all know how harmful radiation is. And this is the amount he wants to earn. is ready to expose an unborn child of 8 month old to radiation. Thank goodness that the lab attendant at that lab said, knew about it. I mean, he was a very conscientious person and said, "You people won't put me into trouble," you know. And she basically said, "I'm not going to go ahead with it," you know. So imagine how many how many kids that we have been born with defects that they got from radiation that were not even defects that they got naturally or something. So most of the kids that have been born with deafness or blindness, because of the effect of the radiation they exposed to them.
So what you're trying to say is that some of these doctors ask their patients to go for tests that they don't need because of the money, the percentage they will get, the accrued money for them.
Exactly. So the people who also told us that they've been asked to go for multiple tests, the same exact same test, multiple times. Even when they got results, they go again.
Nicholas.
Going forward.
Going forward, but before I ask you this last question, the medical association, I know that there are umbrella bodies who are in charge of all these medical diagnostic centers. Did you get any one of them involved before or after?
We spoke to them. We spoke to the Medical Laboratory Association of Nigeria. They spoke to us very well. This person was very open and actually spoke to us very well. Revealed a lot of stuff. But it's just an association. They don't have regulatory powers to regulate their so we spoke to the Nigerian. We spoke to the NMA. They basically didn't tell us much. They were trying to justify it. We spoke to the Medical and Dental Council of Nigeria. In fact, that was even very funny because they were even defending. One of them was actually not the lab. There's a regulatory organization for lab. They were actually defending the labs and saying, no, that has never happened. But we had our evidence already.
So quickly as we wrap up, in your opinion, how do we curb this fraud that is affecting the vast majority of Nigerians?
The government had to be very up and forward about it. And because it's so entrenched that it has taken over the industry. I know after my story was published, I know it's of medical lab owners who are struggling, who are trying to remain ethical and don't do it, how they are struggling and how customers are. So even with the fact that they have the best equipment and their lab produce some of the best results, but they are struggling to have customers because doctors who make the referrals don't make referrals to them because they won't pay the kickback. You understand? So the government has to take a step. So I just to start with this. For instance, my story was published. Nobody has been punished. I got to even the Consumer Council, the Consumer Protection Council, with all the promises in this world that they were going to do something. Nothing was done. In fact, this week I'm going to go back to that story and talk to all of the regulators again and ask them how come a month after the story was published, nothing has been done.
That would be a very good step to take. And Mr. Nicholas will leave it at that. We are pressed for time, but thank you so much for your intervention this morning. We'll keep in touch with you on this.
All right, thank you very much for your time.
Thank you.
Yeah.
Wow, what an extensive report. Mr. Lemmy, you've heard all he said, how some doctors defraud their patients, and from what he said, it's systemic. How would you react to this?
Well, it's first let me commend Nicholas and Premium Times. They've done a great job. Their investigative journalism is quite top-notch. So we must commend both of them, Nicholas and the Premium Times. Going beyond there, it doesn't come to me as a surprise because, of course, we have had encounters and experiences beyond these ones that Nicholas has very graphically presented. It speaks to who we are as a people. It speaks to our value system. We find that unlike in those days when a good name was better than all the riches, we seem to have turned it on its head, and a bad name seems to be better than poverty. And to think that medical practitioners, doctors, lab technicians, owners of laboratories, of course, at that level, they are not poor people. So it speaks to their avarice also, to their greed. We need a rebirth. We need a rebirth as a people, because while today is about the medical field, it's everywhere in every sector of our national life. You know, the only thing is that when a doctor or medical practitioners compromise this way, it can lead to massive loss of lives, as we would have been noticing. We have cases too where doctors in the general hospital will make it so cumbersome for you to access health services, medical services in the general hospital, and they will find agents around the environment to tell you, why not go to so place? They are private hospitals. They refer you there.
Doctors?
Yes, owned by these doctors, consultants, younger doctors. They have places where they have their private practices, and they will rather direct you there. So you find that while the real expertise is in the general hospital, because of the bureaucratic bottleneck, deliberately most times mounted to frustrate the patient, and a patient who is sick is looking for help anyhow. It's not meant to be in long queues, go through some tedious process. And yes, and so if he can afford it, even if it's the last time, he will take the offer. I had a friend who had an accident some time ago, very severe accident. He had multiple fractures. He was even in coma. At the end of the day, it was Gwagwalada Specialist Hospital. This is about 12, 13 years ago. Of course, they were not attending to him until they diverted through their agents. You just see people coming to talk to you. You don't know they have been paid to do that. And they eventually, of course, we as friends and families were frustrated that the guy was just like that. We took him to the hospital, around the referral hospital within Gwagwalada. Of course, the doctor, a consultant, a surgeon, very super in his work. He was able to attend to him. The guy is walking on both legs, is okay and all that. But where the general hospital would have taken far less than 100,000 to attend to him, family and friends had to pay nearly 1 million naira to get him attended to out there.
Still on that line of thought, you just heard Nicholas said that even medical associations, we are kind of in defense of whatever referral kickback scheme that was going on.
Yeah.
So will you agree with those who may argue that it is business for doctors to benefit from referrals?
And do you know how much, again, the leadership of the NMA may also be getting their cut? So that's another angle of investigation that we need to look at. Because ordinarily, if you are not benefiting, I don't see why you will justify such arbitrary and dubious scheme.
So there's a collaboration here by the doctors and the diagnostic centers. Is a whole lot of collaboration to...
Yes, it's a conspiracy to defraud the patient, the unsuspecting patient. And the inaction or decision to justify by NMA even makes them co-conspirators. They have questions to answer. Why they would justify a thorough research, a thorough investigation that shows that if a test is supposed to be 4,000, because you pay the referring doctor 20%, you make it 5,000. Nothing justifies that. Nothing justifies that. So if NMA will wish it away or begin to justify it, then we need to also look at, are they getting kickbacks from that? Obviously, the masses particularly are ripped off in this situation. And the person you should run to is the NMA, and they are not responding. So perhaps again, patients, Nigerians need to, I think we have a new wave now that of consciousness that people are beginning to hold others accountable. So perhaps Nigerians, victims of some of these exploitations, may eventually need to take up action, file formal complaints at the police station. Okay, that way you can invoke the jurisdiction of the police to look at it.
And remember that the program is interactive. The phone number to send your messages is 09022656167. 09022656167. How do we stand against the systemic corruption in our healthcare system? Did you know that you may have been paying for those referrals from the doctors? Hello? Your name and where you're calling from, please.
My name is Stella. I'm calling from Asukoro.
Let's hear you.
This program, I love this program anyway, because I am one of the victims of all these things. Last time I went to hospital to see a gynecology, I was pregnant. I went there, the doctor has a scan machine. After he scanned me finish, in fact, he told me all manner of things I've never heard since my mother born me. At the end of the day, he now told him that he's not perfect in scanning, that he's referring me to another scan, so that the doctor there will witness or to verify, to be sure. You understand? I took the scan, came back. In fact, I cried my eyes out in what the doctor told me. He even wrote a drug for me that I should go and buy. One day I went to the pharmacy to go and get the drug. The doctor gave me BP drugs. I don't have BP. And with my mother born me, I've never had the issue of BP. What was that supposed to do?
Did you go to the lab he referred you to?
I'm not gone. I called a friend. I told him, he said, no, you have to change the hospital. Go to another hospital and be sure. So I have to go to another hospital. When I went there, the doctor said that I'm fine. That nothing is wrong with me. I was like, whether I'm eating well. I said, so, but I think I'm eating well. He said, okay, that you just wrote a drug for me. That is that drugs, I took it for 7 days. I'm not getting better. I should return back. No, because I just take that drug. Not over 3 days, I'm fine. Then what that doctor told me, he said, we'll put me on bed rest, this, that, blah, 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 blah. What did I say then? Oh my gosh. I was so surprised. The fellow was like, even the one I went to meet, the second hospital I went, whenever I came, I gave him the scan, but I did another place. He referred me to another scan again. That he cannot work with this one, and they have to be shot.
I'm happy you did not fall victim to this.
I went to the scan. When I came back, it's the same thing that this one says, that the one I got on my own, the one that one gave me, and they are all the same.
Okay, thank you so much. We are pressed for time, and we are happy that you didn't fall victim to the referral scheme in the hospitals. Hello? Your name and where you're calling from?
My name is Emmanuel Barba. FM?
Yes, you are. You're on to Public Conscience on Kiss FM.
Yes, this is a nice program, I must confess.
Thank you, sir. Go ahead.
Yes, I actually observed that this kickback and referral is happening even in the government hospital. In Nasarawa, in medical center, I took my baby there for treatment, and I got one referral that I should take my baby to case of treatment I know they can handle in that big hospital. If I should, are you with me?
We can hear you. Go ahead.
Yes. If I should take my baby to her medical center in Maraba and I refer him to another hospital in Kensi, the stress and all that. So me and my wife decided that this is what every other hospital can handle within Nasarawa, within even Maraba. So,
did you go to the referred hospital, the referred lab?
I didn't go to the referral hospital, to the hospital they referred me to, because I wasn't convinced that my baby could not be treated there or within the neighborhood, within the Maraba. So there could be another hospital which they're supposed to refer me to within Maraba or Nyanya, not in Kefi. So I have to take my baby to Nyanya, and he was treated of typhoid or malaria, and the whole thing, and we went home then. So I discovered that all this thing is happening even in government hospital, and it needs to be investigated further.
Thank you so much. Thank you so much. I'm happy that the two callers so far said they didn't go to the referred laboratory and the hospital. So some Nigerians are conscious of the fact that this is a scam.
Absolutely. But
you are making a point.
For the first caller, the lady. Now, the psychological trauma is unquantifiable. There's no price to place on that. Because again, she said she never had BP. But she could suffer BP and depression from deliberate false diagnosis, because they wanted to wink her into going to a lab where they will get their cut. It's really sad where we are. And how did we get there? Because you look at it again, lots of people, there's a difference between a doctor who is so-called, because medical doctor profession and nursing are for me like teaching. Callings, it's like a ministry. You are called into the ministry of healing or the ministry of teaching. If you are not called, you just get in there, go get the certificate. You are not going to be thinking about the life you swore to save. You are going to be thinking about how you want to make money from them. And that is the erosion of our values. That is the root of why we are where we are.
Send a message or text message, WhatsApp 09022656167. 09022656167. Hello. Good morning, sir. Your name and where you're calling from?
My name is Daniel. I'm calling from Kaplan.
Let's hear you.
I'm sorry, I just came in and I've not gotten the real picture of the program, but I'm sure I'm sure that something about how something has to do with medical.
You're right, sir. Referral system by some medical doctors in a way to defraud patients.
Okay. Sorry, the last statement I have from whatever doctor in the house here was saying that some of the doctors were not called. So I just trying to be corrected. Before a doctor is qualified, I think they need to go through some processes. So once you are process for your affairs, the doctor has to know that it means you have been vetted and qualified to do so. Now, the issue we have is not only whether it's private hospital or in government hospital, it's a general phenomenon anywhere, anything. I've had a situation where I was sick. I was referred to the state hospital, Yaba. When I got here, the other people I saw, even less not attended. When I saw the situation, I became a little bit relieved. Because, not because of their situation, but because the way it not is how the doctors were talking to these people, somebody that is sick, that's about dying. Instead of the console, to give you confidence, to give you life, they'll be shouting on you. I've seen it not where it's telling me it's a dreaming woman who is pregnant. Seriously on that level, something like that. Why is it because it's so much here? Let me the husband, let me give you the leg. You know, instead of giving you hope, they'll make you that you die for your crime. I was talking about his brother. When you go to hospital, I noticed that doctor will tell you to go to the classes for class or for anything. Now, when you go and want to go, the hospital you go, and because the laboratory or whatever place you go, you notice that the one they will go for you is different from the one they will go for another place. Because I the same test or whatever they will go to is the same.
You have 30 seconds to round up, please.
No, so what you did in 1 hour, I'm sure I will tell you reason why the begin to not take medication or even want to go to hospital because of the stress and you go to the hospital instead of the one getting here.
Thank you so much for your submission. Referrals, kickback.
Mr. Lemi, what do you think is responsible for the culture of kickbacks for referrals, and how can we tackle it? That is one, and you can as well touch on the impact of corruption in the provision of adequate healthcare in Nigeria.
Okay. I think the impact of corruption is even the fact of doctors, or one of the consequences of corruption is the fact of doctors and laboratories colluding in the name of referral for kickbacks. Okay. Like I said, the root of all of these, which the medical field is not is part of, is the fact that our erosion of values. We have placed money above human lives. We want money by all means. The doctors and the lab technicians and laboratory owners are no different from the average Nigerian whose value has been so eroded. Now there is a reason, a failure of the system, a failure on the part again of government, where you and I would need to be local government unto ourselves. We have to provide shelter wherever we can. We also have to take care of the roads to where we live. We have to take care of water, provide boreholes. We have to take care of electricity. So if you are a, let's say, a public servant, a civil servant, or a private person who earns a salary of, let's say, even 150,000, you must be exceptional. If you're a civil servant, you probably have to be like an assistant director to earn 150,000 naira. Now you have family, let's say on the average 3 kids to take care of. You need to send them to school. Public schools are failed, so you need to begin to also look for money to send them to private schools. The average private school, boarding house secondary school, if it's cheap enough, is 300,000. You have 4 kids, you earn less than 150,000. Now, it's not a justification why people should steal, but if we make our systems work, that you and I can access the private public school for our kids to go, that basic transport system is taken care of, and we just have the money to take care of our genuine needs, feeding and clothing, then perhaps corruption itself too, many people will not find it so exciting to go to. How does it work in the civilized climb, in the more civilized climb? You find that if you want a car, you can buy on mortgage and pay a token and begin to pay spread. You can't have that here, yet the transport system is bad. How the transport system is organized. So you find that the failure of the system is one. 2, the fact that Nigerians are now resorting to self-help and the values have been affected because they are resorting to self-help. Survival by any means. Okay, it's like a jungle. Man eats man. So the values that have changed has affected all Nigerians, and because of that, the doctors, the medical doctors, the lab owners, the lab technician and all that are part of the system. Okay, and when I talked about people called, I wasn't talking about qualification. I was talking about people genuine with the passion to be doctors or nurses. If the nurse was so called into it, it's a ministry for her. She will not see a pregnant woman in labor and talk down. She will talk nicely and encourage the woman. So again, this idea of forcing people, parents forcing kids into a particular profession, it has its repercussion. At the end of the day, the child wants to make money, because ultimately, again, unlike in those days, when you take a shirt that is not yours home, from even as an undergraduate in the university, if your parents see you wearing a shirt during the holidays that is not yours, they will ask questions. But now these kids with Yahoo Plus, Yahoo Minus and all that have cars They even buy cars while in the university for their parents, and parents no longer want to say anything. So there's a total collapse of our value system, and it calls for reintrospection and rebirth. The National Orientation Agency and all that must come together, working with civil society. We need to rejig our value system. And
I'm interested in the solution. You were just saying who are supposed to lead this reorientation and change.
You and I, the National Orientation Agency, the media particularly, we need to begin to hold people to account. The idea of some guy spending the kind of money that he does not have an industry, he does not have a franchise, does not have anything, and you see him spending and you give him chieftaincy title. So community based organizations, faith-based organizations, traditional institutions, why should you reward a man for overnight wealth? So, but the National Orientation Agency, which holds the responsibility of rejigging our public ethos, would work with you and I and civil society to rejig it and address matters like that. But this one of the medical doctors, we need to have Nigerians who have suffered infractions like this rise, because if you do not rise to file a formal complaint in the police station and get CSOs to support you, we will just talk about it like this. There is no, they say, you go to the police station, they say accused plenty, no complainant.
I was going to ask you a question. As a patient, when you get to the hospital and you're being referred to another hospital or a lab with a referral booklet, what should that patient do? Should they go to this lab or go to another lab? Because from this report, it said that some were referred to labs that are very far. Meanwhile, there are other laboratories around the hospital, but they were referred to another medical lab. What should patients do? Should they go ahead and go there, or should they go to another lab?
In truth, because this is endemic, it's not exclusive to one or two hospitals practicing this wrong way. Because it's not exclusive, you don't know if the next lab, next hospital is going to be like that. So I ask people, yes, this same practice is also in the general hospitals, in public hospitals, but it is not as bad as when you go to most private hospitals. So what I would always ask is that you deal more with the public hospitals, as frustrating as it is. Deal more with the public hospitals. For me, for instance, for my family, we do the normal general hospital thing. For just a last gap, in case there's a desperate measure, we have a private hospital. That's a fallback. It's like having a main power, then having a standby. So in the public hospitals, it's frustrating, it's tedious, and when you are in real bad shape, you may not be able to stand it. But I advise that it's best for us, if we want to cut down on our risk, to do more with the public hospitals than with the private hospitals.
What then would you advise the government and the medical regulatory agencies to do in order to stop this?
I think it still has to do with who we are. We need to have government more sensitive, more alert. Okay, a lot of talking, a lot of advocacy needs to be done. Even though I wonder, after how many years as in the medical school, you come out and people still need to be teaching you the responsibility of a medical doctor. Okay, it's tragic if we have to be doing that all over again. So it appears we need a miracle, but while seeking for the miracle divinely, we need to all be vigilant. We need to all speak out when we need to speak out. The idea of medical doctors mystifying treatment. You take your child to the hospital and they are just mystifying treatment. They are not talking anything, they are just writing. Sometimes they even say, excuse us. You take your word and they say, excuse us. And people like me won't keep quiet. I tell you, WHO regulation is that you must explain to me every step of the way. I must be there when you are attending to my ward. It's me paying the bills on top of it and all that. But you see, most times, and Nigerians need to be enlightened about this, because most times when you go, you just look at those doctors like that and they don't say anything. They won't ask questions. You react to Septrin. If you keep quiet, you are in trouble. They would have recommended. So you need to speak up. It's your right to be treated nicely by any doctor you meet. It's a right. It's not a privilege.
It's your right. It's our right to be treated nicely by any doctor you meet. It is not a privilege. That's how we're wrapping it up on today's program today. Our time is almost
It's
up.
been a robust discussion, and please visit the news page of our website, news.primorg.org. That is news.primorg.org. For all the details of our report and interviews, visit our website, primorg.org, to get all the information about Primorg.
We sincerely appreciate our guest, Lenny Uwegbe of Make a Difference Initiative MAD. Thank you so much, sir. And also Nicholas Ibekwe of Premium Times. Public Conscience is supported by the John T. and Catherine D. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation at its website, macfound.org.
We urge you to join us again here next week for another episode of Public Conscience, and remember to follow us on our Twitter, Facebook, and Instagram handles at Official Primorg. I am Chidozie Ogbonnaya.
Official Primorg is our social media platform. We encourage you to join us. Decisions should be made in the best interest of the patient and not for any other reason, let alone financial benefits. I am Adaobi Obiagumo. Stay safe.